It's taken scientists just 10 months to do what normally takes 10 years. The UK is about to start its first coronavirus vaccination programme. That doesn't mean, though, that the pandemic is over just yet. Britain's health system is now facing the huge logistical challenge of getting the vaccine to the public, as Tamani G reports.
It's arrived. Croydon University Hospital near London has become one of the first to receive a batch of the Pfizer-BioNTech coronavirus vaccine. The UK is to kickstart its mass vaccination programme tomorrow. Elderly care home residents and staff will be the very first in line, followed by those aged 80 and over and frontline health workers.
So they're stored in the -70 freezer and they will be taken out of there when it's appropriate. The hospital is just going through the final checks to be able to implement the vaccination programme for our high priority groups, and we will roll out when it's appropriate.
The vaccine can't come fast enough as Europe continues to struggle with the second wave. Infection rates and death tolls are regularly breaking records. In Italy, the number of deaths has passed 60,000, making it the sixth highest globally. Despite the festive season, the German state of Bavaria is implementing more restrictions.
The fact remains that the numbers are simply too high. The figures must come down in order not to overload the health system, because that's already a threat. Many beds in hospitals in Bavaria are full. We are already considering developing overload and overflow systems. For example, in Nuremberg, these will be implemented starting tomorrow. So we have an overload of the health system.
Bavaria is currently reporting about 175 new cases per 100,000 people over the age of 7, higher than Germany's national average. New restrictions include a curfew and an order to stay at home unless absolutely necessary. But in the Czech Republic, the virus is not stopping traditional celebrations of St. Nicholas, the original Santa Claus. A drive-through light show allowed children and their families to enjoy the show from the safety of their cars. Hermione G, Euronews.
Oksana Pizik is lecturer and global health advisor at University College London's School of Pharmacy. She says the initial UK rollout will be limited, as there's currently only 800,000 vaccines available.
In terms of this particular vaccine, the Pfizer-BioNTech, the largest logistical challenge by and far will be maintaining that cold chain. And each vaccine is going to be tracked to ensure that it is in the appropriate conditions that has to go en route. We know it can only be moved several times, and each of those routes have to be very carefully managed. So when we look at right now, they are in 50 different hospitals across the UK where there are deep freeze storage facilities available to keep it at that -70, -80 degrees Celsius.
How many people need to take the vaccine to protect the population? And is there some concern that vaccine hesitancy might prevent the right number of people taking it to protect everybody?
So we would be hoping to get up to 60 to 70% of the population vaccinated. Now, the good thing is that this is a very efficacious vaccine. So that does mean that the overall number of people who need to be vaccinated can be slightly lower. But on the whole, I think vaccine hesitancy is an issue. But anti-vaxxers who are slightly different because they had very strong beliefs or opinions before the pandemic, even about immunization. I think the vaccine hesitant group can be convinced based on the evidence.